Munson Healthcare's weekly COVID-19 press conference. Today is Tuesday, January 26th, and I'm Diane Mihalik, Chief Marketing and Communications Officer for Munson Healthcare, and I'll be your moderator today. Munson Healthcare has been hosting these weekly press conferences since December in an effort to keep you updated on the COVID-19 vaccine distribution in Northern Michigan. As a reminder, our webinars are recorded and the full sessions are available and archived on our website, munsonhealthcare.org, and you can view them at any time. Our plan has been to feature our community health partners and local health departments every other week, and we're happy to welcome them back this week. Our speakers today will be Dr. Mark Cannon, Infectious Diseases with Munson Healthcare, Wendy Hirschenberger, Health Officer for Grand Traverse County Health Department, Jennifer Morse, the Medical Director for District Health Department number 10, Lisa Peacock, Health Officer for the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan, and Heidi Britton, Chief Executive Officer, Northwest Michigan Health Services. So now I'd like to begin with an overview of our COVID-19 numbers in Northern Michigan. Dr. Nefsi, Munson Healthcare's Chief Medical Officer, would normally present this information. She cannot join us today, so I will share the most current update and then have Dr. Cannon join us to share any additional clinical insights. So I'm happy to report that our numbers are beginning to stabilize across the Munson Healthcare region. Our cumulative cases are 23,185, and our cumulative deaths are at 525. The good news is that our percent positive rate for the last 14 days has dropped to about 5%, which is much, much lower than what we have been seeing over the past couple of months. Next slide, please. In addition, our hospitalization rates across the region are beginning to stabilize and decrease a bit. As of this morning, there are 34 positive COVID-19 patients across all of Munson Healthcare. And our positive rate with our employees is mirroring what we're seeing in the community infection rate as well, which is beginning to decline a little bit and to stabilize. Next slide, please. As you can see, this is a graph of our hospitalization trends. We did have, the peak just recently that we saw. It's kind of been going up and down every week, but again, we're beginning to stabilize. And we really just want to thank the community for all of your efforts in continuing to mask and socially distance and doing your part, because that really does have an impact on the spread of COVID-19 in the region and directly impacts our hospitalization rates. Next slide, please. So we're happy to report that we have been hosting, as Munson Healthcare, some vaccination clinics across the region. Last week, we announced certain age criteria, and I'm happy to report that as of yesterday, we have expanded that criteria to anyone aged 80 and above that lives within a Munson Healthcare service area. So all of those counties that are listed in that middle box on this slide, if you are 80 years and above, you are eligible to receive a vaccination from Munson Healthcare. You do not need to be a Munson Healthcare patient. We are trying to help out the health departments as much as we can, so anyone age 80 and above. What you'll notice and what you'll hear throughout this webinar is that the criteria for vaccination between Munson Healthcare and the local health departments may vary depending on how much vaccine doses we have available to us. We are expanding and controlling that criteria on sort of an individual organization basis based on our population and the number of doses we actually have to administer. The only exception for the 80 and above age range for getting vaccinated through Munson Healthcare is that if you are also 65 years or older and live in a household with someone who meets the 80 plus criteria, you can also get vaccinated at the same time. So we're trying to make sure that spouses or relatives of those 80 and older who maybe also be caregivers can also get vaccinated, but again, you have to be at least 65 or older and live and reside in one of our Munson Healthcare service areas. Next slide, please. So as we've mentioned before, on January 12th, Munson Healthcare began vaccinating our patients that were 90 years and above. That quickly changed on January 15th when we expanded our criteria to also include community members. Again, you didn't have to be a patient of Munson Healthcare anymore. And at that time, we expanded the age range to 86 plus. On January 19th, we expanded it to, we keep lowering that age range to try to get more people in based on the vaccine availability that we have. On the 19th, we expanded that to 82 plus. And again, this week, we have dropped that down to 80 and above. We now have clinics open in Cadillac, Charlevoix, Grayling, Kalkaska, Manistee, Otsego, which is the Gaylord area, and in Traverse City. Next slide, please. So as of January 25th, Munson Healthcare has administered just over 16,757 doses. We continue to have and host those clinics today. That includes both first and second doses, but we're just really excited that within just over a month, we've been able to get that many vaccinations in the arms of our healthcare workers and the residents of Northern Michigan. And we're really, really proud of that in our partnership with the local health departments. I think the last time we reported, we had 50-some% of our healthcare team actually vaccinated, and now we're actually up to 62.9% of our healthcare team members. That work continues. There are, I think, 130-some healthcare workers scheduled to be vaccinated in our Charlevoix hospital today and this week. We continue to do this. It's really important, as we know, that we protect our healthcare workers in addition to making sure that there are enough vaccines available for community members. So we'll continue to report on those as those numbers will increase. Next slide, please. So before the health departments come on to talk about what their current criteria is and their availability of vaccines and how to get vaccinated through the health department, as a reminder, if you would like to receive a vaccination through Munson Healthcare, you should call 231-935-SHOT or 7468. We have approximately 100 call lines open, available 8 a.m. to 4 p.m. 7 days a week. Those call lines are very busy. We ask that you continue to be patient if you can't get through. And again, we can only schedule the number of vaccinations for the number of doses that we have available. But again, you must meet the criteria of being 80 years or older, and you must live within a Munson Healthcare service area, as we mentioned on the previous slide. And again, this information will be available on our munsonhealthcare.org website, so you can refer back to it at any time. Next slide, please. As a reminder, each week we share the criteria and sort of the rollout that we're following according to the Michigan Department of Health and Human Services. As you can see, we're at the end of January right now, so we're still in the very early stages of getting community vaccinations out there and in the arms of individuals. We are, even though it does say that we can begin vaccinating 65 and older, that's really only if you're a caregiver or within the same household as someone that's 80 and above. And again, that's just based on the availability of vaccine that we have right now, so that we can schedule those quickly for 80 years and above. As more vaccine becomes available, we will drop down to 65 and older for the entire Munson Healthcare service area. But again, this is going to take some time. And the biggest point about this graphic is that it's going to take until December to get everyone in the community vaccinated. So again, we just continue to ask for your patience as the criteria changes and as we have more vaccine available to us. Next slide, please. Again, we want to thank the community. I mentioned earlier that our hospitalization rates are beginning to stabilize. Our percent positivity rate within the community is beginning to stabilize. That is really due to all of the work and cooperation of our wonderful community members in Northern Michigan. We all take care of each other and look out for each other. And because, as Dr. Nefsey has mentioned previously, you're only about 50% immunity once you have your first dose of vaccine. And then after you have your second dose of vaccine, it's going to take at least 10 to 14 days after that to reach about 90-some% immunity. And maybe Dr. Cannon can correct me on those numbers when he comes and joins us. But it really is important that we continue to protect the most vulnerable members of our society and continue to do our part because, again, it's going to take probably until December to get the majority of Northern Michigan vaccinated, and we just can't let our guard down yet. So we just ask for your continued cooperation in that, and thank you for all your efforts. Next slide, please. So now I'd like to bring on Dr. Mark Cannon, infectious disease expert with Munson Healthcare, who's been at the heart of helping us through this pandemic since it began earlier. Actually, last year. It's been about over a year, Dr. Cannon, since we've been dealing with this. So, Dr. Cannon, can you tell us what you're currently seeing about? Well, first, are there any other opening remarks you'd like to make, or anything I missed or misstated?
No, that was fine. I think probably my best role is just to sort of help summarize some of the newer science that's coming out and just help people interpret that and give my take on some of that. So as an introduction, there's actually lots, we could go through. What I did is I'll try to summarize just a few of the more important sort of press releases and papers and that sort of thing. Mostly circulating around, anxiety over, the several major variants throughout the world that have been noted. Now, I mean, there are literally thousands of variants, but at any given time, I expect there'll be a handful that are the most concerning. And then questions around those variants are always going to be the same. And this is going to be an ongoing thing because coronavirus is, they're not the fastest mutating virus, but they're pretty decent mutators. So it's not surprising that we already have some significant variants in the subspecies of the virus. And so this is going to be an ongoing issue. And so it's something we'll talk about often, and that people should try to get their head around and realize that, this the same thing for flu mutates, and we have to chase that continually as well. So it's going to be the same with coronavirus. And the questions that come up with every new variant are, is it more infectious or less infectious? Is it more or less virulent? Those are two different things, right? A virus can be very, very infectious, but could actually lose virulence and not really cause as much illness. The two don't go hand in hand by any means. They can. I mean, a virus can be more infectious and more virulent, which is, kind of worst case. It can be less virulent and less infectious, or it can be, combinations of either. So the UK variant seems to, the other questions that come up with any new variant then are, will our tests still pick it up? Mm-hmm. Which is a very good question. And will the vaccine still work? So those are the sort of things that every major variant is going to it will be looked at by virologists and public health sector folks and actually even private sector who make the vaccine and various governments. It's going to need to be a sort of cohesive and unified effort worldwide to keep an eye on these variants, because, we can do border control stuff, but, they will get through. Once a variant takes significant hold in one part of the world, it's just a matter of time before it's pretty much everywhere. So, we can't separate these problems out as somebody else's problem. We have to all, be in this together. So with those sort of three questions in mind, the UK variant appears to be well covered by the vaccine. It does appear to be more infectious. There initially reports were that it wasn't any more virulent than the wild type strain. Mm-hmm. But there are a few folks in the UK who are starting to challenge that with very small subsets of data, who are worried that perhaps it is a bit more virulent. But then that is not an official study or report or anything, so I don't want to put too much weight on that. At this point, I think the UK variant is more infectious, which is a problem, but there isn't good evidence that it's really any more deadly, okay? The South African variant, a little bit different. It's not more infectious. There is, I think, mounting evidence that it actually is it is more virulent. And with that in mind, Moderna and the U.S. government in conjunction have just announced that they are actually looking into having a booster from Moderna's vaccine that is targeted more specifically to variants such as the Brazilian one and the South African one, which
Dr.
is,
Cannon, I
yeah.
just want to interrupt you. What does a
Sure.
booster mean? Does that
Well,
mean
yeah, I'm just talking about the
another
second.
injection?
Yeah,
Okay.
second or even third injection. Those would be boosters. So most vaccines,
Okay.
you get a single shot. Sorry, with most vaccines, you get more than one shot. You get the initial shot, and then anything after that, just kind of colloquially, you could call a booster. Basically, it's, you know, your immune system has been exposed to that during that first shot, but to boost it again will give you longer lasting, higher immunity. So that's all I mean by booster. And that can come, I mean, some people think of booster as, you know, that when you get 10 years later, your tetanus shot or whatever. But I simply mean, you know, subsequent vaccines after the first dose. So
okay. Thank you for that clarification.
Sure. So I'm sorry, I'm using the word a little bit loosely. Some people don't think of a booster in that way. But anyway,
Right.
that's essentially what you're doing. You're boosting the immune response. So if you know, follow-up shots are a little more geared towards more virulent variations, you know, variants or more prevalent variants, that to me, that was absolutely predictable and absolutely expected. And anybody who knows anything about virology is not surprised that we have mutations and that the vaccine is going to have to be tweaked. I mean, that was a given, I think. Maybe not effectively communicated by the people who make the vaccine or by various governments, but that is absolutely expected. And we do that with flu vaccine. The great thing about RNA vaccines is they're very easy to modify. So Moderna is already working to modify it to better cover not only the wild type strain, but other strains as well. Other variants, I should say. And so, you know, so that's exactly what should be going on. That's exactly the sort of thing that's going to be an ongoing challenge, but it's definitely something that can be accomplished as long as the right people are involved and the funding's in place and there's a political will to do it. Other questions that have come up are immunity. So if you're naturally infected, will you still be protected against these variants? And that is, Rockefeller just came out with a study where they tested thousands of variants against serum, against the antibodies that people had after natural infection. And they found that most of them, those antibodies were still neutralizing, were still effective, with some few exceptions. So again, that's the sort of thing, ongoing studies, and if anything important comes out of those studies, then that would have to be integrated into vaccine management, disease management, et cetera. If you have the vaccine, are you protected against the variants? As I said, the UK variant seems to be probably most likely just fine. Probably a little less protective against the South African variant. With regards to testing, various tests fare better or worse for different variants of the virus. The ones that we use here at Munson are picking up the UK variant just fine. I'm not sure yet about the South African variant.
I think that might be too early to tell.
Yeah, I think you're right about that. We just there hasn't maybe been enough cases in the US yet. Let's see what else. New vaccines on the horizon as well. Johnson & Johnson's adenovirus vaccine is progressing along. They put out some press releases recently about that. An adenoviral vector vaccine is using a common cold virus, the adenovirus, as the delivery mechanism for the COVID's DNA that then our cells translate into protein and then our immune system reacts. So it's a kind of, rather than just putting the RNA like an RNA vaccine, it actually uses an adenovirus particle which has been gutted, so it's no longer, it no longer causes disease, but it's now just sort of a Trojan horse. It's just an empty vehicle that still can bind to cells and deliver the COVID DNA, the COVID virus DNA into cells, so that it can then. And adenovirus has been used for gene therapy, cancer therapy. It's been studied in various vaccines. I don't think it's been commercially released as a vaccine delivery mechanism as yet, but neither had RNA in it, and that's working fabulously. So adenovirus is another, and the nice thing about that is I think that's one that potentially could be fewer shots, maybe even just a single shot. It's probably a lot more stable and could be stockpiled, could travel better than RNA vaccines. There are other disadvantages to adenovirus vaccines that need to be worked out too, because we've all been exposed to adenoviruses, which means we already have an immune response. So that, so they try to design these things so that we will not immediately attack the Trojan horse ourselves. It won't attack the adenovirus vaccine. So there's a lot of things involved and a little more finessing, I think, with adenoviral vaccine. But that's good news because that just gives us more options. And they are relatively inexpensive and easy to change. Maybe not as easy as RNA vaccines, but still very doable. Colchicine, again, this was somebody came out with a press report. No, the data only approached statistical significance. It wasn't even statistically significant, and it was something like their second and third endpoints. It wasn't even their primary endpoint that looked promising. And again, just a press release. There was no actual good data shown. So again, let's not get too carried away with that either, and just
so really our best thing to do right now is to just continue to work with the Pfizer and the Moderna vaccines, look forward to Johnson and Johnson or the AstraZeneca ones, which have not been approved yet, correct? So
no, they have, but but I suspect they will.
Can you also tell us what you're seeing with flu activity in the region?
Oh, right. So I'm not on infection prevention per se, but I have heard that we've had very little. We just had a case, like one of our, I think might have been our first one just the other day. So incredibly.
That's what I heard too.
Yeah, incredibly low levels of flu this year compared to other. And that's actually was predicted in the Southern Hemisphere before flu even got here. They were seeing the same thing. And I think the very obvious explanation is just all of the,
the
masking.
precautions.
Yeah, exactly. The precautions. So that thankfully has been almost non-existent, which is really helped because, you can imagine if you had rampant flu and COVID at the same time, the confusion between the two, which does a patient have? How am I going to treat this patient? Do they have both? Do they have, so luckily that is just unfortunately not raised its ugly head this year.
Yeah, that's actually really good news, and I think something we were a bit anxious about earlier on in the pandemic. So, Dr. Cannon, thank you so much for those initial insights. I do want to have our local other health experts have a chance to make some statements, and then we'll bring you back for the Q&A because there are some additional clinical questions that have been coming in. So we will have you back shortly. Thanks, Dr. Cannon. All right, so now I would like to introduce Wendy Hirschenberger from the Grand Traverse County Health Department to give an update. Wendy?
Hi, thank you for having me again, and appreciated hearing the summary from both you and Dr. Cannon. I'm learning things too, especially from Dr. Cannon. So I just wanted to talk about Grand Traverse County Health Department specifically. So as you probably know, we are a single county health department, and we have a population that we serve of somewhere between, say, 95 to 100,000 people. So our focus of our distribution of vaccine is a mass clinic that we have stood up at the Northern Michigan NMC, Haggerty Center. And we did that in order to expand our throughput and size, and it allows us consistency of one site to set up for many months. So we appreciate that partnership. We are currently focusing on completing those who are in the 1A group, so healthcare workers, the initial first priority, with some with first doses, but mostly most of them getting second doses, and then also starting to work our way through those who are eligible with the 1B priority group, which many are familiar with. Last week we began at the Haggerty Center, and we administered 2,150 vaccines. That includes first and second doses. And last week, there was quite a bit of focus on those who were 65 or older, as well as some of the other first responders who didn't qualify in that initial 1A group. This week, we are proceeding with delivering 3,200 doses, so increase from last week. That includes, again, first and second doses, and the focus this week is really those who are 65 and older, some who also qualify in that 1B group, and then all of the Grand Traverse County school staff. That is a large closed clinic that is, we're partnering with Munson, the National Guard, the superintendents, and many volunteers, and we appreciate all the efforts for those who are making that particular clinic happen. There's quite a cascading effect, as you can imagine, with schools, and so trying to keep schools open, teachers safe, kids in school, that also helps parents and employers and our community as a whole. So by the end of this week, we'll have given in total, since we first received vaccine, about 8,700 doses. And we are using and exhausting the doses as we receive them. But we are still retaining the second doses back as we're required to for those who already have received a first dose. So we schedule those immediately on site. We are able to do at this clinic the same number in one day that we were able to do an entire week at our health department clinic site. So you can see how that really expands our throughput to 4,000 to 5,000 a week at the Haggerty Center. The on-site clinic is very efficient. It typically takes about 20 minutes to get through, and that includes a 15-minute wait time. It's a very positive and happy place to be, and we are so appreciative that our community is very excited and eager to get the vaccine. So we have expanded the location. We are consistently working with kind of health department staff being all hands on deck, as well as the National Guard and volunteers. But the demand is definitely far exceeding the supply. And so for Northern Michigan, we continue to advocate to get more vaccine in our Northern Michigan area as a whole. Next slide, please. I'm sorry, let me go back and explain the graph. The graph just shows our progression of our vaccination clinics, where you can see the first kind of 4 weeks we're at the health department, and then once you see the numbers start to increase, that shows the projections once we move to the Haggerty Center. And it also shows how we weave in the first and second doses. Now, next slide. So what do people need to know about getting an appointment in Grand Traverse County? The primary mechanism for scheduling appointments is via our scheduling software, and the link is located at gtcountycovid.com/vaccine. Because we are essentially going to be providing 140,000 doses of vaccine over the course of the next 10 to 12 months. That's a very high volume. This is the most efficient way for us to do appointments. We do not have the staff to have a full-on call center, and like I said, we are really at the site administering the vaccine with the large volume. Appointments are made on the schedule as we receive vaccine. So right now, it's a pretty quick process once we open up appointments. Last week we received less than 1,000 doses to administer. So once we open the process, the slots tend to fill very quickly. People who signed up through the planning registry, that did not reserve an appointment. And so it is really important that you either try to go back to the scheduling link. You can also schedule through the United Way if you are 65 or older and have technology challenges or some hardships, and also through the Munson process that you said with your criteria. We did partner with the United Way to work through the over 8,500 people that initially wanted to be on the registry for the 65 and older. And so they are working their way through that list as well. Just know that United Way is working on it, but it might take longer to get an appointment. But it's just a matter of kind of waiting until the supply opens up. There's over 17,000 people who are older than 65 in our county, and that doesn't include all the others who are also eligible for the 1B group. So you can see how far the demand exceeds the supply currently. So we are in the process of trying to push out some more information to help explain the process better. There's been a lot of questions that we're still continuing to get, so we hope to have that more readily available for everybody. And I just wanted to say again how much we appreciate the Michigan National Guard, the partnerships with Munson, our other health departments, and then the volunteers as we move through this pandemic. Thank you.
Great, thank you, Wendy. Now I'd like to introduce Lisa Peacock, who is the health officer for the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan. Lisa, welcome back.
Thank you. Thanks so much for having me, Diane. So the Health Department of Northwest Michigan and Benzie-Leelanau District Health Department are facing similar challenges as Wendy described for Grand Traverse. Our biggest limiting factor certainly is the number of doses that are allocated to our region. And so first I'll focus on the positive. Number one, last week was our biggest week in both jurisdictions. We gave over 3,000 doses in the Health Department of Northwest District, and we gave over 1,000 doses in the Benzie-Leelanau district. And so that's really important. It's an important indication of our capacity. We are standing ready with capacity, including hundreds of community volunteers who have come forward, completed training, registered through the Michigan Volunteer Registry, our National Guard, our hospital partners, our community partners. So we are all ready. And when that vaccine becomes more widely available, we will be vaccinating the community very, very quickly. We have the capacity to do it. So we are currently completing the healthcare workers in the 1A first priority group with first and second doses. We have a few stragglers who signed up late, and we're continuing to reach out to them and work them into our mix for vaccinating each week. We are in the process of scheduling different size clinics in different parts of our communities. In both of my jurisdictions, we are a district health department, and we cover several counties over a rural area. So we have well over the population of Grand Traverse County between the two districts, but we have to reach them in a little bit different ways given the rural distribution. So it looks like several different sizes, types, and locations of clinics. But that's what we do. We are used to that, and we really appreciate the partnerships and helping us to identify different sites where we can reach our communities in the furthest corners of our counties. We are working on the 1B priority group currently, the first responders and school staff and other segments of 1B that have been deemed eligible, and the over 65 population. We are following, the guidelines that do ask us to use 75% of our vaccine allocation on those 65 and over. So we are keeping a list, a pre-registration list on both health department websites. People can access them easily at those websites. And then we use that information to plan our clinics for the coming week ahead. We are also using an online scheduling mechanism, but what it looks like is that those are emailed out to people on our list. So it is important that you go ahead and register on those lists so that we know that you're ready and want the vaccine. We will be working on also communication strategies and, just constantly striving to improve our communication strategies, especially for our seniors who may not be as able to access our usual online strategies through Facebook and website and email updates. We're working specifically on a strategy to reach out to those who are on our pre-registration list to give them kind of a weekly update as to how much progress we've made and where they might stand on our list. So know that those are in the works, and we want everyone to know that we are advocating for our area. Demand definitely exceeds supply right now, so we know that we're ready when we have those doses available, and we are constantly advocating with our state partners for the needs of the people in Northern Michigan. I already talked about going to the website to complete our online form to pre-register and get in that queue for scheduling. If we have businesses who are representing an employee population, we just need them to fill out one form, and we will use that point of contact to reach out to you. And I want everyone to just remember the hotline that has been set up. Wendy mentioned it already, to assist seniors who may not have access to the internet through the Area Agency on Aging of Northern Michigan, the United Way, and 211. It's been such a helpful tool, and they are also, taking that information, keeping people on a list, and then we are working with our aging partners, our COA directors and our senior service directors to have assistance for those who are on that list and need to schedule in a way different than our online scheduling method. We just ask for everyone's patience as we navigate these unpredictable and limited allocations, and know that we are all doing our best for you, and we will get to everyone eventually. This process will just take some time.
Great, thank you, Lisa. Appreciate those comments. Next, I'd like to welcome back Dr. Jennifer Morse, Medical Director for District Health Department number 10 for an update. Welcome back, Dr. Morse.
Thank you. So my message is quite similar to everybody else's. We continue to face limitations in supply, but we continue to persevere and work hard to get it out to as many people as possible. We also have quite a few individuals in phase 1A that present themselves to be vaccinated, and so we're working through them, as well as getting onto 1B and those that are over 65, and working with our local schools to get them vaccinated. If you go to our website, again, similar to other processes, dhg10.org/COVID-19-vaccine. It is very clear, hopefully, how people can sign up based on their category. We're also utilizing the hotline that Lisa mentioned to help those who may not have internet access or have difficulties signing up online, to help them get on our wait list. We encourage people to sign up for our regular updates and emails to help let them know about upcoming events, which include vaccination clinics. We continue to vaccinate about 1,000 a week. Up to date now, we're up to just under 12,000 we vaccinated in our 10 counties. So again, we utilize what's given to us as best as we can. And again, our message is pretty much the same as the other health departments.
Great, thank you so much, Dr. Morrison. I think we will wrap up the statements with an update from Heidi Britton, the CEO of Northwest Michigan Health Services. Heidi?
Thank you. Next slide, please. Thank you. So I'm just going to be the caboose of the train today. And what I hear is that we've made progress since the last time we had our press conference, which is huge. And I see that we are giving the vaccines, that we're getting them out of our refrigerators, and we're putting them in the arms, which is awesome. And I think that the work that the health departments are doing and Munson is doing are truly, it's just awesome to hear as far as our community is concerned. Northwest Michigan Health Services, we continue to support, as you know, as each FQHC, which is Northwest Michigan Health Services, the health departments, the hospitals, are receiving vaccine allocations separately and at different times. So again, it just really shows when all the health departments shared their information, how they're approaching this. They're different. They have different allocations. Counts and requests are based on the number of employees, patients, and residents. They continue to remain uncertain, as we heard today, which I think can be frustrating at times. However, I think that we are definitely making lemonade out of our lemons at times, and I think we're doing a great job at it. Our collective goal, of course, is to be fair and equitable distribution, transparent as possible. And it looks a little different in each county, as they all shared. So definitely sign up, get on those newsletters so you can hear what's happening and keep abreast of what's going on. Next slide, please. And we continue to partner with the health departments to help support their vaccination efforts, as including our own patients here at Northwest Michigan Health Services. So just remember, my message really today is to continue to look at the health departments as our leaders as we are moving through this process. In MHSI, we are gassing up our mobile health clinics so that when we do get the vaccine, we're able to come out into the communities. We've received a lot of questions if we can come out to the peninsulas or, wherever, right? We will sign ourselves up. We will have a system in place when we are there so that if you have a need, you'll let us know and we come out just like we did with testing. We had a pretty organized system at that point. We plan on doing the same method. We have been doing a couple of vaccinations in our practice clinics in our parking lot to try out, having people in cars get vaccinated, as I see Munson has done as well. So we will continue to wait until it's our turn to start vaccinating out in the community. Hopefully it'll be some windfall of vaccines at some point over the next 6 to 12 months, and then we'll really kick it into full gear. So that is all I had to share today. Thank you for letting me be on this panel, as always.
Great, thank you, Heidi. Now I'd like to bring all of our panelists back for our Q&A session. We do have quite a few questions coming through, so I'm going to get right, jump right into them. The first question is for Wendy at the Grand Traverse Health Department. Can you just clarify, I'm super excited about the partnership with NMC and the Haggerty Center. Can you clarify, is that indoors or is that drive-through?
That is an indoor location. There's large space, there's good ventilation. We do have good spacing. Everybody who is working the site or enters the site is required to wear a mask. There's hand washing, sanitizer throughout, and it's a safe site for vaccinations.
Great, thank you for that clarification. Lisa, this next question I'm going to ask of you because you represent two different organizations. I thought you might know this like the back of your hand. This question is from one of our reporters. Your group has said previously that it's okay if you get a call both from Munson Healthcare and a local health department, and it's better to have two calls or two registrations in the one. Now we are seeing reports of people double registering to see what appointment they can get first. Is that causing any logistical issues for us, and should people be encouraged or discouraged from doing that?
Mm-hmm. That's a hard question to answer.
I know.
Especially as the, as the pharmacies are now kind of ramping up in preparation for the day when they will also have vaccine and are keeping waiting lists as well. And so, what we want people to know is that if particularly the health department website pre-registration list and the AAA United Way 211 list, those are getting merged together. So there's no need to sign up on both of those. I did have a question yesterday from someone who had signed up on a local pharmacy list who actually won't have vaccine until it's available to the general population, which is several months away. And they were 90 and they wanted to make sure that they were all set if they had signed up on that list. And in that case, no, they're not. They need to sign up on our list as well. And so, we certainly err on the side of making sure you get in the queue. And that is really important. And it's certainly for our population 65 and over. If you have any question or trouble signing up on anyone's list, the best thing to do is to call the senior hotline, and they are trained to assist you. And we will make sure that you get what you need.
That's great. And it is going to continue to remain a bit complicated into the near future. Right. I'm going to ask this next question of Dr. Cannon. This is a new one for me. This is coming from a reporter. I don't know if you have any insight into this, but I'll ask it anyway. There have been reports of COVID-19 vaccine being sold on the black market. Have you heard about that in Michigan?
I don't really peruse the dark web, so no, I don't. My advice would be don't take it that way. That's all I can say.
Well, and just to clarify, we're all getting our doses directly from the state of Michigan and their distribution. So I have not heard of any, and please other panelists jump in, but I have not heard of any black market doses being in Michigan, but that doesn't mean that's not happening somewhere.
There are just reports on the internet that you can, through the dark web, buy 10 doses for 10,000 or whatever, shipped from nebulous places in Europe or whatever. It's nonsense. Just,
okay.
I would not be tempted.
Right. Dr. Cannon, one other question. Should someone still wait 90 days after a positive diagnosis of COVID-19 to receive the vaccine?
Oh, yeah, I'm afraid I don't know since I haven't been really involved in administering the vaccine, I'm not sure what the most recent guidelines. That was something that I know that was a policy in the UK and maybe here for a short while, but then I'd heard it was shortened quite a lot. So that would be something on the CDC's website somewhere. I'm afraid I don't know off the top of my head.
Right. Dr. Morse, I know that Dr. Nefsi has addressed this too. Do you want to, I think you may know the answer to this.
Yeah, it's up to the individual to decide that if they would like to wait. So you should wait until your acute illness has passed and of course you're out of isolation. And then if you would like to wait, you can wait up to 90 days. Knowing that the further you get along in that 90 days, your immunity may be dropping and you're more susceptible to infection.
I think
I was going to mention. I was going to mention about the black market situation. We have had issues with people sharing their confirmation emails for appointments or having them getting shared on Facebook, and people coming from out of town or other locations trying to take other people's appointments. So that has happened. I've heard that's also happened in other health departments. And I'm speaking now with my hat from Central Michigan District Health Department. I cover a few health departments. So we have heard some of that happening, where again, people are driving. We heard as far as Detroit coming up, trying to get into one of our vaccine clinics with someone else's appointment confirmation email, kind of as their ticket to try to get in. So that unfortunately has happened.
Fascinating. I had not heard that. So thank you for that, that insight. We're getting a lot of questions about volunteers, and we're a bit out of time, and I don't think we have time to go around and ask everyone if they currently need volunteers for their clinics, because we're all running different clinics. So what I'd recommend is we'll take the lead on gathering that information and posting that in our FAQ, so that if any of our panelists here do need volunteers for their clinics, we can put a link on our website to make sure that people can sign up for that. We're also getting a lot of questions about the National Guard being involved with these clinics. And again, this is not something new. It may be new for them to be helping out with some of the health departments in this capacity with these mass vaccination clinics, but the National Guard has been helping Munson Healthcare even with some of our healthcare worker vaccinations, and it was just really incredible to see them come in and help out, and we were very grateful for the continued efforts in our community, and just thank them, and again, all the community partners who are coming together to do this. And then a lot of questions about how do I know if I'm registered if I call in? How do I double check? Again, if you call in to Munson Healthcare, just know that we have your information and we will be getting back to you. With the health departments, I think it may vary, but just know that if you sign up through one of their registration portals or call, then you can be guaranteed that they have your name, we know who you are, and we will be bringing that back. So we will try to get to all the questions that weren't answered on this press conference. Again, we'll update our FAQ section. Again, I think one of the biggest resources for everyone in the community here is this 211 Michigan. It really will help connect anyone to the correct local resources for you based on your county of residence. So we encourage you to use that 211 line if you're, maybe unsure about which direction you should go to try to receive the vaccine. Also, the Area Agency on Aging of Northwest Michigan is a really incredible resource. And again, for those 65 and older, and you should really call the senior hotline. That can really help you get connected with the right way to get vaccinated in your area. And I think we have one more slide that just shows a summary of the other health departments. So again, we'll post all of this information on our website. This recording will be available for anyone who wants to refer back to this information. But again, gosh, we always share so much information that we run out of time for the Q&A. So but we will try to get to everyone's questions and post them on our FAQs. I want to just thank Dr. Cannon for joining us with some really interesting information on the status of the vaccines and how they're made. So we'll continue to have you back to keep us updated on Johnson & Johnson and AstraZeneca and any others that are on the horizon. And all of our other local health officials, again, we really appreciate your collaboration and your partnership. And we will hopefully have this panel back again in 2 weeks to give another update. But next week, we will focus on some additional updates from the Munson Healthcare perspective. So we're looking forward to having you join us next week at 11 o'clock. Thanks, and have a great day, everyone.